This training is being brought to you by MARO, Bloodborne Pathogens. This training material was prepared under a Consultation Education and Training grant awarded by the Michigan Occupational Safety and Health Administration, MIOSHA. MIOSHA is part of the Michigan Department of Licensing and Regulatory Affairs. In this training, we will review the MIOSHA Standard Part 554, Bloodborne Infectious Diseases, and MIOSHA Standard Part 33 and 433, Personal Protective Equipment, definitions of bloodborne pathogens and illnesses associated with it, diseases bloodborne pathogens can cause, risky situations at work and in the community, and how to protect yourself using universal precautions and personal protective equipment. A quiz will be provided following this training. MIOSHA requires an employer to provide accessibility to a copy of the MIOSHA Standard Part 554, Bloodborne Infectious Diseases, and MIOSHA Standard Part 33 and 433, Personal Protective Equipment, and Employer's Exposure Control Plan. Please ask your supervisor or human resources staff for a copy of these standards to review. MIOSHA Standard Part 554, Bloodborne Infectious Diseases, require an employer to review all routine tasks and reasonably anticipated tasks and procedures at a work site to determine which employees may be potentially at risk of exposure to blood or to potentially infectious body fluids. Based on this worksite evaluation, an employer shall categorize all employees into one of two categories, Category A or Category B. Employees in Category B are not reasonably expected to have exposure to blood or other potentially infectious materials during a regular workday. Employees in Category A may have exposure or reasonably anticipated exposure to blood or other potentially infectious body fluids during a workday. Employers are required to maintain a list of all Category A job classifications employees to ensure proper training. MIOSHA requires that employees in Category A be provided training on bloodborne pathogens. Training must include information on bloodborne pathogens risk and hazards associated with the job. Training must also include information on personal protective equipment, when to use it, how to use it properly, and the care and useful life of the PPE equipment. An employee must be able to demonstrate an understanding of their PPE equipment training. Bloodborne pathogens training must be provided at no cost at the time of initial hire and again on an annual basis. Both trainings must be provided at an educational level appropriate for the individual employee. Employees in Category A therefore are required to complete bloodborne pathogens training at the initial time of employment and again on an annual basis at minimum. Training, again, must be at no cost and provided during working hours. What are bloodborne pathogens? A pathogen is something that can make you sick. It is a germ or a virus or bacteria. Bloodborne means that it can be carried or transmitted in human blood. Pathogens can be present in human blood and sometimes other body fluids. So, a bloodborne pathogen, or a BBP, is something that can make you sick, that can be carried in human blood and a few other body fluids, but transmission of these illnesses can only occur if you come in contact with it in certain ways. These specific ways are called risky situations. More information will be shared about risky situations later in this training. There are numerous types of bloodborne pathogens. However, for the purpose of this training, focus will be only on three. These three diseases that are bloodborne pathogens in nature that are included in the MIOSHA Standard 554 bloodborne infectious diseases are HIV, HBV, and HCV. HIV is a human immunodeficiency virus, the virus that causes AIDS. HIV may affect the whole body, and there is no known cure. There are two other strains of hepatitis covered by this rule as well, hepatitis B and hepatitis C. These two diseases affect primarily the liver organ. HIV, Hep B, and Hep C are all focused on for very different reasons. There are three examples of certain ways bloodborne pathogens can enter your body. Contact with non-intact skin. For example, a first aid provider helps an injured worker but wears no protective equipment, and the provider has a cut, scratch, or sore on their hands. Or through mucous membranes, the eyes, nose, and mouth. For example, a blood splash or accidental secondary contact between a contaminated gloved hand and face, or through a wound from a contaminated sharp object, for example, a dirty needle or broken glass. How do I know if I may be affected? What are the signs and symptoms of HIV, hepatitis B, and hepatitis C? Early or onset HIV is usually accompanied by rapid, unexplained weight loss, chronic fatigue, night sweats, and a proneness to infections like sinus infections because the immune system is compromised. Hepatitis symptoms tend to be more flu-like in nature, such as stomach pain, nausea, vomiting, and fever. With hepatitis B, symptoms tend to be more severe. A person feels sicker. In many cases, however, after the symptoms are on their course, an individual not only feels better, but there is little reoccurrences of the disease or any of its symptoms. With hepatitis C, the symptoms tend to not be as severe. In many cases, a person may not know they are infected because they do not feel sick. There is a very high rate of long-term complications and chronic infection. There is no vaccination or preventative medicine for hepatitis C or HIV. However, there is a preventative vaccination medicine available for hepatitis B. New infections have declined dramatically, primarily due to routine vaccinations. Hepatitis B vaccinations are 95% effective. It includes 3 shots, which are administered over a 6-month period. The Center for Disease Control recommends vaccinations for everyone under age 18 and for any adult who is at risk. Long-term studies of healthy adults and children indicate that hepatitis B vaccination protects against chronic hepatitis B infection for at least 23 years, even though antibiotic levels may decline. The hepatitis B vaccination is a MIOSHA requirement. An employer must offer the hepatitis B vaccination within 10 working days of the time of initial assignment. An employer shall make the hepatitis B vaccination available to each employee at risk of exposure, to first aid responders, and if an employee initially declines vaccination but later decides to accept the hepatitis B vaccine, the employer shall provide the vaccination at that time. In addition to blood, there are some other substances that can transmit pathogens. In the MIOSHA standard, these body materials are referred to as other potentially infectious materials, or OPIMs. These include the body fluids that are associated with sexual activity, body fluids surrounding the brain, spine, heart, lungs, stomach and joints, or any fluid that is contaminated with blood. Sometimes it's hard to determine if blood is present, so therefore all body fluids should be treated as though they are contaminated with pathogens. Body fluids that do not transmit bloodborne pathogens unless visibly contaminated with blood include saliva, unless dental procedures are involved, urine or feces, vomit, sweat, or tears and spit. There are risky situations both at work and in the community that may lead to exposure to bloodborne pathogens. An attachment to the MIOSHA Standard Part 554 is a list of 32 very specific job titles to whom or to which the bloodborne infectious diseases regulation applies. Usually these are Category A types of jobs. At the top of the list, as you might expect, is healthcare personnel like doctors and nurses and emergency medical technicians. It also includes first aid and CPR responders, which applies to those who are trained and authorized to deliver first aid or CPR in the workplace and anyone involved in any type of personal care. It also applies to housekeepers, laundry workers, and maintenance staff. Anyone with custodial or janitorial responsibilities, particularly if the area you're responsible for cleaning in a building includes the restrooms. It doesn't matter if you're in the office or out in the community at a school, at a store. If you're helping someone who is injured or ill, at some point it is very likely that you may come in contact with blood or body fluids. There are also other job categories which we don't traditionally think of right away that fit into the risky situation job category, such as barbers and beauticians, cops and correctional officers, plumbers, and tattooists. This list is provided to show that there can be a broader scope of situations outside the healthcare environment that can present a risk for many other types of employees. Risky situations in a community in which bloodborne pathogens may enter a body is through unprotected sexual contact with an infected partner, sharing drug, tattoo, or piercing needles, sharing personal items like razors or toothbrushes which might have blood on them. Transmission can also occur from an infected mother to her baby during birth, and individuals receiving donated blood prior to July 1992. Anyone receiving donated blood or a blood transfusion prior to July of 1992 should consult with a healthcare professional. Universal precautions mean you should be careful at all times. It should be assumed that all blood and bodily fluids are infected, and you should always take precautions to protect yourself before you assist someone with an injury and before you clean up an incident area. Emergencies will happen. Employers should anticipate that incidents will happen and make sure proper tools and materials are available. Most employers have multiple first aid kits available that provide both treatment supplies and personal protective equipment gear. Make sure potentially infectious materials do not get in you or on you by using the appropriate personal protective equipment. Single-use gloves are probably the most important item when working in potentially bloodborne pathogen situations. Gloves can be made of a variety of materials such as latex, nitrile rubber, or vinyl. All are acceptable in creating an effective barrier to and preventing skin contact. People who are trained and authorized to administer CPR rescue may use breathing masks or other personal protective equipment items that you see, including eye protection, mask, shoe covers, and gowns. Here's an example of how to properly remove single-use disposable gloves. When the first glove is removed, it should be pinched from the outside at the base of the glove, as seen in Figure 1, and then slowly peel the glove back. When that first glove is removed, it is acceptable to throw it away. It is suggested to hold your hands in a downward position to prevent fluids from moving towards your body or clothing. For the second glove, as seen in Figure 3, use an extended finger and reach under the glove and pulling it out a little so it can be pinched from the inside. Then carefully remove the glove off the hand. Be careful to not make contact with the outside of either glove. This glove should also be thrown away. As a rule, with all personal protective equipment such as gloves or gowns that have been used or have been contaminated, each should be turned inside out and placed in a designated container. Contaminated clothing should be removed as soon as possible and washed separately from other items in a bleach and water solution. After gloves have been removed, wash your hands and any other exposed skin with soap and water. Waterless disinfectants and alcohol wipes are effective germ killers and may be used only in the absence of soap and water. When cleaning up after an accident, still wear the appropriate personal protective equipment. It is also important to know what cleaning material is acceptable for proper disinfection or to kill germs. One of two cleaning liquids can be used, either an EPA-registered disinfectant or a bleach water mixture. An EPA-registered disinfectant will indicate on the label what type of pathogens it is capable of combating. A mixture of bleach and water is also effective. The recommended ratio for environmental surfaces like a floor or a countertop or a piece of equipment is 1 part bleach to 10 parts water. If it's being used as a laundry solution, it can be diluted down to 1/100 and still can be an effective germ killer. As a note, when cleaning up any sharp objects, never use your hands for this task, not even gloved hands. Use tools like a broom and a dustpan, tongs, or some other device so that you do not make contact with a contaminated sharp object. Items that have absorbed or are soaked with blood or other body fluids are considered regulated waste. These items should be disposed of into a specially labeled red bag that has a biohazard symbol. A biohazard symbol is shown on the screen to the left. Regulated waste must never be disposed of into a regular trash container. Sharp objects or items should be placed into a sharps container, which is shown on the right of the screen. A Band-Aid, a gauze pad, or a tissue with a small spot of dried blood on it does not need to go into a red or biohazard bag. These items may be wrapped in additional absorbent material, like another tissue or a paper towel, and placed into a plastic bag. This bag can then be placed into a regular trash container. In addition to providing bloodborne pathogens training, an employer is required to provide a workplace exposure control plan. An exposure control plan is a written policy for your workplace that addresses this MIOSHA regulation. An exposure control plan includes information about what jobs are at risk for exposure to bloodborne pathogens, a hepatitis B vaccine policy, control methods for protecting against bloodborne pathogens exposure that include universal precautions, such as where hand washing facilities are located, what protective equipment is needed, and how to properly dispose of waste. A post-exposure follow-up plan will describe what happens in the event that someone is exposed to a bloodborne pathogen type of situation. If a bloodborne pathogens exposure incident occurs, it is very important to inform your supervisor or management immediately after. After an exposure, that employee must immediately be sent for additional care by a medical expert such as a doctor to determine what future treatment may be needed. An exposure control plan also includes information about training and record keeping. Ask your supervisor or human resources representative for a copy of the exposure control plan for your work site. For more information regarding bloodborne pathogens, talk with your supervisor. Other resources include contacting MARO at www.maro.org, or you can visit the MIOSHA website at www.michigan.gov/MIOSHA publications. Thank you. Please wait for the next prompt to complete the bloodborne pathogens training quiz.